This is Jennifer Johnson. I am filming my speech 2. It's an informative speech over CPAP breathing machines. This is my dad, and he is going to be demonstrating the CPAP machine today. This speech is to inform you of the main reason for the use of CPAP breathing machines in the home setting. That reason is sleep apnea. We will discuss the types of sleep apnea, the diagnosis of sleep apnea, and CPAP treatment with sleep apnea. I have some handouts for you guys today. This is a picture of a blocked airway versus an open airway, so that you can kind of see how the obstructive sleep apnea works. The word apnea is a Latin word that means a suspension of breathing. Sleep apnea is a medical condition in which a person stops breathing in their sleep. CPAP breathing machines work to correct these problems so that sleeping is no longer a danger to the patient. There are two types of sleep apnea, central and obstructive. Central sleep apnea is a temporary lack of communication between the brain and the respiratory muscles. Obstructive sleep apnea is caused by an obstruction in the airway, usually where the tongue falls back and blocks your esophagus. When you are being diagnosed of sleep apnea, you are taken to a clinic in a controlled setting, kind of like this room. You have a bed and a CPAP breathing machine, and they monitor you with an EEG. They monitor your brain activity, and that helps to diagnose whether it is central sleep apnea, which is a brain malfunction, or obstructive sleep apnea. Everyone has some normal apneic periods in their sleep. However, if you have an episode that lasts 20 seconds or longer, that's considered an abnormal apneic episode, and that is how you're diagnosed with sleep apnea. In central sleep apnea, they usually treat that with medications. If it's a brain malfunction, then the positive airway pressure doesn't usually make a big difference. However, in obstructive sleep apnea, the main problem is that the tongue falls back into the esophagus and it blocks your airway. So what CPAP breathing machines do is they apply continuous positive airway pressure, which is what CPAP stands for. These masks are worn at night or any time that you sleep, even during naps during the day. Put this on. Some are nose pieces, some are face pieces that cover your whole face. Just depends on the patient's preference. Put the mask on like this, snap it in place, and you turn it on. There are different settings for different levels of sleep apnea. For the more severe cases, they go up to 10 or 15 centimeters of water pressure. But in some cases, they only need 5 or 7, just depends on the patient and the severity of the disease. In conclusion, we discussed the two types of sleep apnea, central and obstructive, how sleep apnea is diagnosed by sleep studies and by the patient having apneic episodes of more than 20 seconds. And we also discussed how CPAP aids in the treatment of sleep apnea. Thank you very much for watching. I hope you enjoyed it.